This is week 5's topic for the Ethics and Research Methods course. We'll review the case of Dr. Borison and Diamond at a very high level. Please note that when you look at Blackboard and the discussion board, it'll be a continuation of this specific topic, really to get your opinions and your thoughts about this overall case from that standpoint. So to begin with, let's go back a little bit with some information we have talked about before, but there are really two specific areas that we can see that clinical research can do, in a sense, unethically, to either better the outcomes or get quicker results. And that's really to either falsify data or falsify patients. There's a lot of other types of items in between that people can look at, shortcuts or things of that nature, but this is really where we see more of, if you want to call it, truly unethical practice. We do know that, again, there are others, such as those who may not provide a full informed consent or some other variations of items from that standpoint. One item that seems to be missing at times, especially when we review cases specific to clinical research, be those cases that are items that we feel would never happen in today, but happened years ago, or cases that we just talked about on our discussion board this semester, which are fairly recent. So we see there's a lot of items that could come up, and we really need to have some kind of common sense within our field. There needs to be follow-up. There needs to be a watchdog. And the question is that the IRB? And there also needs to be someone who's following the decision making. And really, who and when applies to all three of these. Who and when does the follow-up? Who and when, from an IRB standpoint or a watchdog, really looks to see how things are moving forward? Is the protocol being followed in all the specifics that are put together? In decision making, sometimes if we want to say from a pharmaceutical perspective, the go, no-go decision, or even decision making on approving an informed consent document. Again, who and when should this be done are very common sense items that sometimes are just missed within the overall process that people are going through. So what I'd like to do is to discuss one case. It's a mental health study area with Dr. Borison, a psychiatrist, and Dr. Diamond, a pharmacologist, who were both at the Medical College of Georgia. The reason that I bring this specific case up is that a number of years ago, when I was teaching a classroom style versus online for ethics class, I had the opportunity to have Dr. Diamond come to our class. And as we go through this, you'll see a number of items. And I'll come back to that near the end just to provide you some information from that standpoint. So the charges specifically of these two clinical researchers really come from claims that the two of them working together spent 8 years conducting over 100 research projects. And they did these projects for multiple pharmaceutical companies, US and international. The issue that came about, though, is financially where the proceeds were going. And it's really kind of an interesting item to think about from that standpoint. And one of the questions that I do ask in our discussion board for this week. So the whole process began to, in a sense, as it says, unravel when there was a complaint about irregularities in the medical management of research subjects. And this becomes a concern. Anytime there's a complaint about medical management, we want to make sure that, again, we have a watchdog, we have an IRB, we have someone who's taking a look to make sure that the process is being followed appropriately and that the care that is provided is at the highest level. So we look at a number of items, especially when something is brought to the attention of an organization. And there was a study coordinator who basically brought this up. But that specific person didn't even know that they were working for a research enterprise and were not part of the Medical College of Georgia. So they brought this up to the Medical College itself. And if you do a little research on this, you'll find out that we have people in positions for these types of studies with these researchers who really do not have a background or training to be able to provide some of the higher level clinical research understanding that should be involved. Now, I will state that this is back in 1997. Clinical research is still a fairly young profession, and back then it was even younger. We didn't necessarily have a large number of programs that were offering different degrees in clinical research. There were a few programs that were, beginning at the master's level, so it was still fairly kind of learn on the job type process back at that time. When you go through and do some reading about this and do some of your research, you'll find out that there's a 3-inch thick chronicle history of these gentlemen's work. And if you want to think about that, if you do have our book, the Oxford textbook, that's roughly 3 inches. So you're talking something that is multi-hundreds of pages long. That is looking at, I would say probably close to 1,000 pages overall. And what happened as this all began to come to light for many people is that there were a number of items that were looked at, and there wound up being a grand jury in the state of Georgia. And Borison and Diamond were said to have really developed and executed a scheme for which they stole in excess of $10 million from the Medical College of Georgia. They also said that these gentlemen routinely lied to conceal their crimes. They endangered the safety of patients and other study participants, and that they were actually employed to serve and protect and heal these participants. So now we have a number of items that have come up in a case. One, we have a financial aspect. And while we can understand that some money may flow different ways, when we're talking into the hundreds of thousands of dollars that may be funneled certain ways, we get concerned. When we look at $10 million, we really get concerned. And if the role of these two researchers, again, Borison, a psychiatrist, and Diamond, a pharmacologist, was to protect and research and fully study the area in mental health, we do have some other issues to deal with in looking at vulnerable populations as well. So a number of items are brought together to really look at from this specific case. They actually did research in a number of areas. And what's concerning overall is it was not just one specific area of mental health. They were involved in schizophrenia, in anxiety, Alzheimer's, different levels of depression from severe to mild, although not listed here, bipolar. They were really on a number of areas, and they were considered the premier researchers. The publications they put out, the research that they had, people followed and felt that they were really, in a sense, they were leaders in the field as this was going on. So now you have this dichotomy of a pair of researchers who are looked at as being leaders, who work with a number of organizations, who are broad-based, looking across multiple types of mental health issues, which are very important still today to look at, to try to find different aspects of how to help patients with these disease states. So the allegations, as I mentioned earlier, began to come out as the trial began to move forward. The use of untrained or undertrained or inadequately trained personnel. And again, I bring back what I said earlier. In the early 90s, there were not necessarily trained clinical researchers who are going through programs and courses like you're going through. So they had to be trained on the job. And if you don't have the right background or don't provide the appropriate training, then the personnel really cannot perform to the level that they should within the research. So now we have additional items that are coming up besides just the money side of looking at what's going on. However, it does become rather interesting is that they're not accused of any plagiarism. They're not accused of falsifying or faking data in any way. Bottom line is that this was the dispute between the Medical College of Georgia and these two researchers. It's about money. And all the other items came about because of looking at the money. So as an example, when these two gentlemen decided to open an office right across the street from the university and the medical center, many thought that that was still an affiliate part of the university, when in fact it was not. So now you have a number of different aspects to look through. The grand jury returned a total of 172 counts of criminal misconduct against Richard Borison and Bruce Diamond. And as I mentioned, I had the opportunity of getting in touch with Dr. Diamond basically upon his release from serving his sentence in jail. And when I called him, he was, I think, rather surprised that anyone was interested in his story now that he was out. And I explained to him that we have a course that we teach, and at that time, probably about 25, 30 students in live lecture format in a master's level program. And that we really would like to get his perspective of what happened, and would he come and provide a 1-hour presentation. Dr. Diamond agreed. We paid for his transportation, we paid for his hotel, and we gave him an honorarium just as we would any other person who is, brought in to serve as a guest lecturer for a course. There were some caveats, though. Dr. Diamond would not allow us to record the session, nor are we allowed to distribute any of the slides or any other information from that standpoint that he directly used. And I was perfectly fine with that. And, the idea was, let's just hear what he has to say. Well, one of the items that was important was to make sure that the students understood, because this would be a public document. And this is just a little excerpt from what many would call a disbarment letter. And basically, this is part of the letter to him saying that the Food and Drug Administration is proposing an issue to order a debarment for 10 years for providing services in any capacity to a person that is approved or pending drug product application. And this comes from the FDA. So one item you have to remember to think about is that means any FDA trial. So if Dr. Diamond decided that he was going to move to Europe or move to another country, he was not disbarred there. And he has every opportunity to continue his practice in that area and how to go forward with that. When he did come and present to the class, he did talk about some of the time that he spent in prison and some of the issues that you have with that. But probably the most striking item is when he was done, we thanked him and asked him to leave, and we had a discussion with the students. Probably the most striking item was that most students felt that he did not, even at this time, did not see that he did anything wrong. Even though he had spent 10 years in prison, even though all these items had come about, he felt what they did was correct. They treated the patients appropriately. There was no falsification of data. There was no falsification of patients. Everything was tracked the appropriate way. He just didn't see, as I would call it, the common sense side of clinical research and making sure that it's patient-centered, patient-focused from that standpoint. So I encourage you to take a look at Blackboard. Do some additional research. You can go out and see actually some newscasts and watch some videos about this. There's a lot of information online about this case, and I'd encourage you to go ahead and provide some comments to the questions that are posed in the discussion board for this week. With that said, I'd like to shift gears and talk about the cases that are available now for the class to look through. You should have seen an email that I sent out or an announcement that I did shift the syllabus slightly from what is written in the syllabus. Instead of having every single student do a presentation on the specific case they're working on, I've shifted this to be a paper. The list is online right now in class under week 5. You can choose any one of those items from the list. It does not matter to me if I wind up having 8 students doing the same item, as long as they're not all working together on that item. You can work in pairs if you would like. That's totally up to you. If you have a colleague or something that you've been in a couple classes with and you feel you'd like to do that, perfectly fine. Maximum of 10 double-spaced pages. It's due by the 21st of this month. And there are some specific items to be aware of. When you're presenting this kind of a case, I'd like to see a title page. Don't forget a title page is about the case you're doing, but your name and information. Introduction. It's not a summary of what's out there. You're introducing the topic, the methodology, either the protocol or the information that you're looking at that is part of the reason that you're looking at this case. A discussion section. What are the relevant topics? What analysis do you want to take? And what are the key points that you want to make from that standpoint about the discussion side and looking at one side versus another side or different viewpoints of what is the topic you're working on? And conclusion is your interpretation. So if you're working in a pair, that means you have to agree on your interpretation of what the overall process has been and where it goes. Lastly, make sure you include any references if you do any online looking, research, anything else from that standpoint. Again, maximum of 10 pages double-spaced. If someone is interested in providing this as a case, I'm more than happy to set time to record the presentation. If you'd like the experience of doing it, I'm happy to do that. We'll set it up in such a way that the student and I will be able to be online at the same time. You can provide the information from that standpoint. I'm encouraging everyone to include with this 10-page document just an outline of what you would do in presenting the case. Nothing detailed at all, just an outline that would talk about the case, would talk about these 3 aspects or something else. With that, I'll close off this specific section and look forward to reading more information about your thoughts on discussion board.